Hi, I am Nur Alisha Shafi binti Nur Zuliraman, and today I'm going to show you what is episcleritis. Let me introduce what is it. So episcleritis is an acute unilateral or bilateral inflammation of the episclera. So what is episclera? Episclera is a thin layer of tissue between the conjunctiva and the sclera. The episclera is composed of loose connective tissue with vascular supply coming from the anterior ciliary artery, which is a branch of the ophthalmic artery. So the infected eye usually appear red due to the inflammation, and also this disease can affect one or both eye. As you can see on the screen, here I have attached two images of eye, which is the first one is the normal eye, while the second one is the episcleritis eye. So in the normal eye, we can see a radial superficial episcleral vessel in a normal condition, while in the episcleritis eye, we can see the maximal congestion of episcleral vessel as they are already inflamed by many factors. To give a more clear view, let me zoom in into the image. So from the image above, you can see the different shade between the tissue. Now we know clearly where is the episcleral tissue located. Episcleritis can be divided into three types, which are sectoral, diffuse, and nodular. So in sectoral type, it means the infection are limited to a specific sector, which I can say it is a localized inflammation. While in diffuse episcleritis, it is the most common form of infection. This type is characterized by a more widespread inflammation of episclera, which may infect entirely of the eye. So the entire episclera may appear diffusely red or pink. So lastly, there is a nodular type, which is from the name, it tells us that there are a node that arise from this layer. So this type is a less common compared to diffuse type. The presence of node or small arise area from the tissue. It can be localized or vary in size, and also may happen more than one nodule. After all of that, now we want to know how this problem starts. So it will start with an infection of bacteria that arrive at the episcleral tissue. Then, acute inflammation will happen in the tissue. So when the inflammation happens, it will activate immune system that will release inflammatory mediator. So this mediator will cause vasodilation, increase in vascular permeability, and influx of macrophages and white blood cells to remove all the bacteria from the body. So this infection may last between 2 until 21 days. Etiology or cause of the episcleritis is commonly unknown, but there are maybe some causes that will lead to this problem. So first of all is the infection. Infection of either viral or infectious bacteria can trigger some individual. Other than that is the allergy. Allergic reaction to substance like pollen, dust mites, or certain medication can also lead to this eye problem. Next is the disease. Diseases such as rheumatoid arthritis, systemic lupus, erythematous are commonly associated with this type of manifestation. The exact mechanism by which autoimmune disease trigger episcleritis are not fully understood, but it is believed that immune cells infiltrate the episcleral tissue, leading to localized inflammation. So lastly, in vascular disease, some cases, the vascular disease may contribute to the underlying inflammation that leads to the episcleritis. The symptoms of episcleritis are maybe feel like common, which is redness, tearing, mild discomfort, and photophobia.